Good morning everyone. Now I am going to talk on the topic non-carious lesions of the tooth. In non-carious lesion we are going to deal about erosion, abrasion, attrition and abfraction. Now we will see about erosion. Erosion is defined as a wear or loss of tooth surface by the chemical action in the continued presence of demineralizing agent with low pH. Etiology of erosion is two types: intrinsic factors and extrinsic factors. Intrinsic factors include recurrent vomiting, that is anorexia nervosa and bulimia nervosa, medical conditions like GIT disorders, neurological defects, GERD, that is gastrointestinal reflux disorders. Extrinsic factors include occupational factors like wine tasters, swimmers, diet, medicaments like ascorbic acid, aspirin, and lifestyle. Clinical features of erosion include occlusal surface, increased incisal translucency, wear on non-occluding surfaces, and in raised amalgam restoration, there will be seen hypersensitivity and pulp exposure in deciduous teeth and loss of surface characteristics of enamel in young children. Management include identification of the etiology is the important thing. If excessive dietary intake of acidic food is discovered, patient is advised to decrease the intake and symptoms of GERD is seen, adequate medicaments is seen, and occlusal splint can be used and dietary modification, use of topical fluorides can be used. Now let's talk about attrition. Attrition is the mechanical wear of incisal or occlusal surface as a result of functional or parafunctional movements of the mandible, that is tooth to tooth contact. Etiology of attrition includes stress, airway issues, and sleep apnea, mainly due to tooth-to-tooth contact. Clinical features of attrition include in older patients, the enamel of the cusp tip is worn off due to the occlusion, and heavy occlusal loading from clenching result in the presence of carious lines which are limited to enamel. Carious lines are not sensitive, and slowing of wear by appropriate restorative treatment is indicated. The sharp edge can result in tongue or cheek biting. Rounding these edges does not completely resolve the problem but does improve their comfort. Now let's see about aberration. Aberration is defined as abnormal tooth surface loss resulting from direct forces of friction between teeth and external objects or frictional forces between contacting teeth component in the presence of an abrasive medium. Important etiology of aberration is that brushing technique, brushing force, bristle stiffness, time, frequency, and habitual chewing on hard tissues, chronic use of agents with high abrasivity like smokeless tobacco, inadequate washed vegetables. Clinical features is due to caused by dentrophysis, causes a V-shaped or wedge-shaped ditch on the root side of the cemento-enamel junction. The angle formed by the depth of the lesion and the enamel surface is sharp one. Lesions are wide than deep. Premolars and cuspids are commonly affected. In aberration is most commonly affected left for the right-handed people, that is the dominant handed people will be affected by the opposite side of its dominant hand. Abfraction is defined as a loss of tooth structure or microfractures in the cervical areas of the tooth due to abnormal tooth flexure. Etiology: bruising, also known as teeth grinding, misalignment of the teeth, that is malocclusion, mineral loss due to acidic or abrasive factors. Clinical features include abfraction lesion will generally occur in the region of the teeth where the greatest tensile stress is located. Tooth sensitivity more susceptible to sensation from thermal or mechanical sources. Treatment include fillings, mouth guard. If you clench or grind, mouth guard will guard the teeth from damage. Toothpaste and orthodontic appliances can be used for younger patients. Thank you.